So now, good day to all of you who are joining us, our international viewers, and all of you who are more comfortable in interacting with us in English. Today, the topic with which I am going to discuss is arthritis. Arthritis, which is also known as joints pain in less technical language, knee pain, back pain, cervical problem, sciatica. There may be various kinds of pains that are occurring to a person suffering from arthritis. But to be honest, whenever a person is suffering from arthritis, that arthritis is a disease in which the immune system is automatically damaging the joints. Premlata ji, your mother's RA factor has come to normal. That is a really good thing for us. Thanks a lot for the admiration. May God bless her with even better health. Now, talking about arthritis, it is the pain and the stiffness, which are the two major things with which a patient approaches us when the person is suffering from arthritis. The pain. When we are talking about pain, the pain can be of varied types. In a rheumatoid arthritis patient, the patient may complain of lesser pain and more stiffness. In a patient suffering from gouty arthritis, a person may complain of pain in the metatarsals, the big toe of the foot. And in a patient suffering from osteoarthritis, any major joint of the patient, especially the knee joints in case of aged patients, may be the joint which is suffering. So all these are different manifestations of arthritis, in which the arthritis which I shall be discussing to begin with is rheumatoid arthritis. Bhavesh Kumar Jhaji, you require guidelines for reducing the swelling in foot. The common thing is Dashmula. Dashmula is a herb which is a combination of 10 herbs, Brihat Panchmul and Laghu Panchmul. Shalparni, Prishnaparni, Brahati, Kantkari, Gokshur. These, and then Bilv, Agnimant, Shionat, Patla, Gambhari. These are the 10 herbs which are the part of Dashmula, and this powder you can purchase anywhere from market. You can even get it from us, and you need to boil it, make a decoction of this powder, and dip your feet daily in the decoction, in the warm decoction. Add a bit of sandhav namak in it, that is rock salt, and you can try this. If there is no underlying major disease like kidney disease or liver disease, this will definitely give recovery. But if it is due to some underlying major disease, in that case we need to go through the reports and then we can guide in a better way.
Mr. Deep Singh, he's saying that he has referred a patient to us of arthritis, and patient is very good now, good recovery is there, but he need to know about his wife case. She is having osteoarthritis.
First of all, thanks a lot Mr. Deep for referring a patient to us, and it's really very satisfying to know that the patient is improving. And as far as osteoarthritis is concerned, in osteoarthritis of knee joint or shoulder joint, I generally advise, if the osteoarthritis is not very advanced stage, then the single stop destination Nirogam's Rheumo Care can be given at your place itself. And if the osteoarthritis is a troubling one, then we shall require the X-ray reports of knee joint or the shoulder joint, whichever is the affected joint. You can forward it through our mobile app, and our team will then be connecting to you and guiding you what exactly needs to be done, whether there will be certain medications that will be self-sufficient or there are panchkarma therapies that are required. In any case, do not stop the physiotherapy. It is good for her, and always advise her, if it's a knee joint osteoarthritis, that when she is to sit even on a chair, the legs should not be folded for more than 90 degrees. The lesser she folds her legs, the better it shall be for her. And do take warm water. She should take warm water. It will definitely help her out. Yes, the next question.
Shilpa Rona question is, in case of osteoarthritis, can knee joint replacement surgery be avoided, and can Panchkarma help to a person work properly with knee joint pain?
Shilpa Rodaji, your question is really very right, and it is one of the common questions which comes to us when we are getting calls from people who want to avoid surgery. See, at least in 70% of the patients who are being guided for knee joint surgery, the surgery can be avoided. There are another 30% where the surgery is very must. We are not giving that kind of Ayurveda where we misguide someone. So what we always do in osteoarthritis patient is that we request the patient to send us the X-ray, the digital X-ray or the MRI of the knee joint, whichever you have proceeded. We will then see that what exactly is the scope and what exactly is the advancement of the osteoarthritis of knee joint. And there are at least 70% chances that with the help of Panchkarma and Ayurvedic treatment that we are giving, it can be reversed. It can be brought to an extent where no surgery is required and the patient can lead a very happy and a very healthy life without knee replacement. There is a question from Neelam ji also, that when she wakes up in the morning she is having back pain. It can very easily be curable. Ask her to start taking warm water before going to bed at night. Make sure there is no constipation. You can use ajwain potli for fermentation on the back. And if the problem is more, you can try Reumo Care capsules which we make. That is the simplest thing, and I feel that a mild back pain or a moderate back pain can be reversed with that only. And if the problem is more, we always have Panchkarma and advanced kind of Ayurvedic treatments also for our arthritis patients.